Great. Thanks so much. Thank you for everyone for joining us today for MVC's very last work group of 2025. We're finishing things out with a health and action work group today, where we're hoping to celebrate our 2025 QI achievements or your achievements in QI. And then also hosting a discussion to think through your 2026 goals as we head into the new year. My name is Emily. For those of you who don't know me or haven't met me before, I'm a site engagement coordinator with MVC, and it is my pleasure to be facilitating this work group along with my fellow engagement folks, Jessica Suva and Rachel Folk today. All right, so plan for today. I'm just going to review a couple of housekeeping and P4P credit reminders as we usually do. And then we're going to do something a little bit different than we usually do for work groups. We're going to do some reflecting and then go into some breakouts and talk, like I mentioned, about your 2025 successes and 2026 goals. And then we'll finish up with just a couple of reminders about MVC events going into 2026, and we'll close out. All right, so just a couple of reminders. This session is going to be recorded. We won't be able to record the breakouts. Those sort of get paused. But if this is a discussion that you'd like to be able to look back at, or if you'd like to be able to review the slides, those will be provided in the follow-up email before the end of the day. Please also be sure if you are not speaking as a part of the discussion to mute yourself to reduce the background noise. Just ensures that we get the best possible recording of our discussion as possible. And then also a little bit different. If you have questions throughout the presentation today, feel free to call those out, unmute yourself, or pass a question or a comment into the chat. This is going to be a little bit more fluid, less presentation-like, but we'll be keeping an eye on that chat in case there are any questions or concerns throughout. All right. As a reminder, for those of you that are attending this work group for P4P credit, the very last opportunity to achieve P4P credit for 2025. Throughout the work group, please engage with us, ask questions, make comments.
Approval of the minutes.
We will also be sharing the post-work group survey at the end of today's work group, as well as in that follow-up email, and completion of that survey is mandatory for achieving credit for your attendance today. All right. So hopefully these faces look familiar to you. This is MVC's engagement team. Like I mentioned before, myself, Rachel Folk, and Jessica Suva, and we are really excited to be chatting with you. Okay, rolling into a little bit of an introduction. In June of 2025, MVC rolled out our second iteration of our QI survey. Some of you on the call may have been the folks to have filled out that QI survey. And so I wanted to do just a brief rundown of some of the information that we gleaned from that survey, and then also kind of what we did with it. So the goal of that QI survey for us is to help us ensure that we're aligning both our and your priorities throughout the year. It helps us inform our offerings and development of future opportunities for you, as well as our metrics. We also use it to support best practice sharing, increasing cross collaboration to achieve all of our shared goals. All right, so just a little bit about who sort of completed that QI survey. We had 65 hospitals represented in our responses. Additionally, 8 physician organizations this year, which is notable. In the past, we've not had physician organizations complete this survey. So we were able to get a little bit of a look at PO goals for 2025. And then there were about 15 hospital systems represented in those responses as well. I'll note that nearly 80% of MVC's hospitals are a part of a system, but we have about 20 sites. Some of you are here today that are independent. Okay. A little on those priority quality improvement initiatives that were noted in that survey. As a reminder, the respondents were asked to identify what your site's priority initiative was from a range of 15 different categories. And these were sort of the primary results. 26 sites identified sepsis as being their primary QI focus for 2025. 15 noted that readmissions was their focus. And 4 sites each noted either transitions of care or population health management as their goal. And then 3 sites identified emergency department care as their primary initiative for 2025. We had many other initiatives that were noted as being primary focuses, including chronic disease management, post-discharge follow-up, stroke, cardiac rehab, pre-op testing, opioid management, addressing social influences in health, and pharmacy utilization. Each of those was identified either once, 1 to 2 times across our sites. Right. Additionally, within the QI survey, we asked to learn a little bit more about common barriers that you are identifying in your work. And what I kind of did here was created a word cloud myself. Making those barriers that were identified most frequently a little bit larger. So obviously insufficient or lack of resources, staff burnout, high turnover, or staff shortages, and insufficient funding for programs or initiatives were identified as the most common barriers to your QI work, amongst other items, which I've noted there for your review. But we don't want to focus too much on the barriers right now. We did also collect from these surveys, this was primarily in the kind of open response section, your suggestions for what to improve upon or what to continue to offer in 2025. And we also took some of these into 2026. So some of your suggestions included ensuring that data and our reporting, that we offer specific trainings to our site coordinators, that we offer recordings or summaries of work groups for those that are unable to attend these wonderful sessions where we have really great discussions, more user-friendly reports, smaller and more frequent breakout sessions, which we're excited to continue to do today. And then data and QI topics that are helpful for all types of hospital sites. So thinking about systems as well as rural and critical access, independent hospitals, and ensuring that our data and these conversations are relevant for all. Okay, so let's just a little bit about what we learned from those QI surveys. Next, we're going to do a poll within Mentimeter. Some of you that have been in attendance to MVC's networking events over the last year may have come in contact with Mentimeter. There's a couple of different ways to join us for these polls. One would be to hop on to www.menti.com and indicate that activity code, or you can use the QR survey, the QR code to access this survey. And then I'm going to pull it up on my computer. So bear with me as I switch screens. Okay. Everyone been able to log on to Menti? I'm seeing some thumbs up. Okay, I'm going to progress to our next slide. If you are having any trouble or needed that QR code a little bit longer, I realize I kind of pushed us forward. That QR code is back up on the screen right now, so you can use that to join. Okay, so what we first wanted to do was something just a little bit fun. In one word, if you can access this, describe your organization's QI progress in 2025. Yes, we started with a positive word, positive. Okay, excellent. I love word clouds. They're just so fun and interactive to watch being created. So I'm seeing improving is like really big, which means several of you have typed in improving. Steady, exceptional, effort. Yes, yes, QI definitely is going to require some effort. Meek is interesting. That'll be an interesting one to unpackage a little bit. Okay.
I have a couple messages here, people. If you're having trouble getting into Mentimeter, you're welcome to put your one word in the chat too.
Yes, definitely. I'll kind of call out any that I see in the chat. Okay, so we'll move on. Structured, that's another one. It just came through. Robust. Okay. So, our next poll is looking at which QI priority area you were focused on. So just trying to take a sense of the room. Obviously, I shared that there were kind of those four buckets that were most popular when we completed the QI survey, but for those of you that are in the room today, what were kind of your focus areas from your perspective in 2025? Great. Looks like primarily sepsis. Got some folks that were focused on transitions of care and readmissions. Sepsis, I'm seeing coming through in the chat. Great. All right. All right, so this is hopefully a fun one. I tried out a new Mentimeter poll style. Basically, what you should be able to do is reorder these barriers to identify what your top barrier is, and then maybe the least significant barrier to your QI work. So hopefully it works. Funding and allocation, Andrew called out in the chat. Okay. It's working for someone because it changed. Okay, great. Okay, so looking like we're kind of aligning currently with the responses in the QI survey with staff burnout, high turnover, staff shortages continuing to be a primary barrier. Insufficient or lack of resources, and then insufficient funding for programs or initiatives being those top three. Okay, so not too many surprises here. We know a lot has happened in 2025, so it's one of the reasons that we wanted to kind of give you a space to call some additional things out if things had changed. Okay, and then this is the last question in this poll session. This is an open-ended response. What QI initiative or QI outcome from 2025 are you most proud of? And I'll give you a little bit of time to put in a response there. It could be something really short and sweet, or if there's something really specific that you wanted to share, you're welcome to do that here. Great. Sepsis bundle compliance. Okay. A cause analysis program. Maintaining low readmission rates. Okay. Changing order sets to improve their utilization. Increasing senior executive leadership engagement. That's great. I saw that as a barrier that was noted a couple of times in the surveys. Maintenance of sepsis bundle compliance. A 20% increase in CMS sepsis bundle compliance is great, amazing. Prepared proactive teams. That's lovely. Kind of goes along with ensuring that you've got your leadership engagement, getting your team engaged as well. Okay, reduced length of stay for ambulatory surgeries. And is it CAUTI improvements? Great. Okay. Any others before I close out this open response? Got a sepsis improvement called out in the chat. Okay. Sounds great. Well, I'm gonna end that presentation. Thank you for all for engaging with us on that. It's always kind of fun to see these things pop up on the screen. I'm gonna switch back to sharing these slides. Okay, hopefully this is working and switching back and forth to different screens for you.
You're good, Emily.
Awesome. Okay, so now that we've had you guys reflect a little bit on 2025, MVC wanted to take an opportunity to reflect a little bit on some things that we hope we brought to you in 2025. So first off, kind of how we were thinking about using that QI survey data. First and foremost, we primarily utilize that data to help identify presenters to come and share their QI work with you at various MVC events. We also used that information to inform content for 2025, including things like our work group topics and approaches, breakout sessions, and additional like data exploration opportunities for you. And then in 2026, because we needed some time in 2025 to prepare for this, we were able to develop an expanded education opportunities and some more flexible options for you, knowing that there is a lot going on and there's a high demand on your time. Okay, so just a couple of call outs here. We had 16 sites engage with us in presentations at various MVC events in 2025, from our collaborative wide meetings to our work groups. So thank you if anyone is on the call today who did a presentation for us. We really love hearing from you and your colleagues, like hearing about your experiences and your successes as well. With regards to 2025 content, we did try out a new kind of work group style. We hosted 2 work groups this year. They were also health and action work groups. So if you're here today, you might have been there for those, where we reviewed in quite a bit more detail MVC push reports and talked a little bit more in detail about those reports and how they connect to MVC's data registry based data. I will also note here that in response to the request for more accessibility for the content from MVC's work groups, we also have been sharing work group blogs monthly for the last year, and we'll continue to do that. And then lastly, with regards to 2026 offerings, I mentioned we were able to develop an expanded education opportunity for our site coordinators. We are offering a site coordinator education program in 2026, and about 25% of our current site coordinators are enrolled in that program for the start of the year. So I'm really excited to get that going, and I'm hoping to expand it to be able to enroll other members of our community in the future. All right. Just quickly, MVCs continue to offer lots of different data resources to you, including our online data registry, push reports, and custom analytics. In 2025, we had about 108 new registry users added to that data registry. We shared a variety of new push reports, including our process measures push report, common conditions and procedures push report, a health outcomes variation report, and we continue to share that ED-based episodes report with you. And then we also completed 14 custom reports, which are individualized data reports designed between members and our analytics team. All right. Um, In terms of other successes, we've seen a major push in your engagement with us in 2025, with average engagement points earned at about 1.76. That's in comparison to last year's average, which was 1.7. And I expect that these numbers will actually rise a little bit. We have a few activities that have not been recorded yet into those numbers, including today's attendance to this work group. So with that said, about 45% of our hospital members have earned the maximum of 2 points. That's out of 106 total sites. And all but one P4P eligible hospital has earned at least 0.25 points. So we've really seen a growth in engagement from you. I will also call out in terms of accessible reporting. We also were able to share in 2025 engagement point reports are now on MVC's data registry. So you're able to see on a quarterly basis an update to your engagement point status within the P4P reports on the data registry. So hopefully that's a little bit more accessible and easier to monitor throughout the year. All right. So before we get into breakouts, I just wanted to very quickly share these charts indicating the distribution of episode spending and value metric selections for program years 26 and 27. When I looked at these, I noted, hey, sepsis is still probably going to be a major focus for this group, but we had kind of an interesting distribution of interest as well in CHF and cardiac rehab. So just kind of calling that out. If you are from a P4P eligible site and are not familiar with your site selections and would like to be in the know, please reach out to us. We've got a variety of ways that you can access that information, and we'd be happy to direct you there. All right. So what we're going to do next is break into some breakouts. Just looking, we've got 24 participants, Jessica. So
I'll put you guys into breakouts and then I'll make sure that everybody gets somewhere.
okay, sounds good. So we're gonna break up into two different breakout groups. Jessica's gonna hang back just in case you get kicked out or you need to leave for a second and come back in. She'll be your go-to person, and we're just gonna talk a little bit about your 2025 experiences and where you're hoping to go in 2026.
All right, here we go.
All right, everyone. Welcome back. Hopefully, we had some good discussions. I guess there was really only one other breakout group, so hopefully, you guys had a great discussion as well.
Yeah, that's good.
I'm just going to pull up. I'm not sure if Rachel shared this in her team. We were chatting, and so I kind of just filled this out. But um, while our groups were chatting, we were kind of filling in some of these tiles um, for those three different discussion prompts. So, kind of what are your priorities in 2026 and how have they been influenced by 2025 priorities? Um, Thoughts on alignment across your QI departments, across your systems, across the state, or maybe different hospital kind of groupings. And then support ideas. Any additional thoughts on ways that MVC could potentially support you moving into 2026. So just kind of looking at this, it looks like most of us spent the primary amount of time talking about 2026 priorities. Um, I will chat a little bit about our group. Obviously, sepsis was a major priority for a lot of sites in 2025, and it sounds like will continue to be a primary focus in 2026 with regards to QI. A lot of sites have been focusing on standardizing their approaches to managing sepsis, um, things like removing duplicative order sets and ensuring order sets are designed not to fail. Um, but other kind of areas of focus were in reducing preoperative testing. So one of our sites that was in our group is engaging with Right Size with their pilot initiative to reduce preoperative testing before low risk surgeries. And then they're looking at potentially expanding that to other sites within the system in 2026. Um, Rachel, do you want to speak to any of the 2026 QI priorities that were brought up with your group?
Yeah, sure. We had a very similar discussion about sepsis being a big focus and kind of all-encompassing. So, readmissions for sepsis, length
Mhm.
of stay, the compliance for the bundle, and post-discharge follow-up, and trying to get that kind of figured out. Um, we had some, let's see. Discussion about like what folks are doing for their sepsis to kind of um, be more targeted with their
Mhm.
QI. And so Irene from Oakland shared that they are trying out a new trial of adjusting the order sets in the ER for their
Mhm.
sepsis patients and kind of looking more at the fallouts. Um, as they go to kind of focus on that detail for improvement. So, um,
Okay,
well, no, we had some good discussion.
great. Um, I'm not sure if you guys got to chat about alignment at all. Primarily, what was brought up in our group um, was sort of internal alignment between CMS and HMS. And, we didn't call this out, but in 2026, 2027 program years, MVC is working to align with HMS sepsis metrics. So that is something that we worked on for program year 26 and 27 for you, for those of you that selected sepsis related metrics for P4P. Um, and then with regards to support ideas, I do see up there that someone in your group, Rachel, was really excited about the site coordinator education program.
Mhm.
So I am also very excited about that as well. Like I mentioned, we'll hopefully be able to expand that program in years to come to fully encompass more members. Um, and then our group also discussed that, within my Michigan's quality department, they're looking at identifying kind of a new committee structure for thinking about quality improvement with their local quality leaders. And this might eventually lead to some needs for different structures or approaches to sharing data, with nursing leadership and other kind of focus areas within those committees. So something for us to be thinking about down the line. And I really appreciate Stephanie for bringing that up. Okay. Um, with an eye on time, I just wanted to give another minute or two for folks that are on the call if there's something else that you would like to add to the discussion. Otherwise, we will finish things up with just a couple of reminders for MVC events in 2026. Okay, sounds good. Okay, so we're back to these slides now then. Um, Okay, any questions? I also did not ask if there were any questions, but not much to question on today's presentation. All right. Well, we are looking forward to future work groups with you in 2026. We've got two planned for January. We will be starting off with sepsis on January 13th, and then an additional health and action work group on January 29th. And then in February, it is Heart Month. So we'll be talking cardiac rehab that month. If you've missed any of the last couple of MVC work groups, as I mentioned before, we have been sending out summary blogs for each month of our work groups. So if you'd like to look back and kind of get a high level review of our work group topics, please read those. The work group recordings are also linked to that. So it's kind of a nice, quick way to access those as well. All right, and then just a reminder here that our engagement team is thinking about 2026. We've been thinking about 2026. So if you are interested in scheduling a site visit, we've got that request form up and running here. It's a really lovely opportunity to learn a little bit more about MVC and our offerings, but then also for us to learn more about you, your QI goals, and any needs that you might have that we can hopefully fulfill. And then additionally, we have our call out for presenters for 2026. So we're looking for presenters for work groups as well as our spring collaborative wide meeting. So if you've got a QI initiative, or honestly another topic that you think would just be of interest to your peers, let us know. Send us in a proposal and we'll get in touch with you to talk about next steps. All right. We will go ahead and share the link for the work group survey. That'll be in the chat for you. Be sure to complete that and indicate the site that you would like your attendance for today to be credited to. And that's it. Thanks so much for attending today's Health in Action work group.